Let's discuss interviewing on the thorax or the chest. Inquiry should be made about whether there is pain, tightness, heaviness, and agitation in the thorax region. Pain in this thorax is often caused by heart or lung imbalances, but the liver can also be involved. Cramping, tight pain in the heart that feels as though the heart is being squeezed in a vice is due to cold. If the pain is sharp, piercing, or stabbing, there will be heart blood stagnation. A burning pain is the result of heat. The heat can be both deficient or excess. If the chest feels tight, as if there is a metal rim or a piece of elastic around the chest, making it difficult to breathe in, this is a sign of chi stagnation. A similar sensation is that of having a large stone or weight on top of the chest. This will also inhibit the breathing and the chest will feel blocked. This sensation results from the presence of phlegm blocking the movement of chi in the upper jaw. Heat in the upper jaw can give rise to a feeling of unease and turmoil in the chest because the heat agitates the chi. The sensation may also be experienced when exogenous evil heat penetrates deeper and affects the pericardium. Patients with acute cardiac and chest pain should immediately be referred to a Western doctor for further examination. The chest or thorax refers to the part of the body enclosed by the ribs and breastbone. From the Chinese point of view, there is a difference between the front part of the chest, which is under the influence of the heart and lungs, and the sides of the chest, which are under the influence of liver and gallbladder. The front of the chest is also the area where the gathering qi, song qi, is concentrated. So we have here the chest area, the lungs and the heart, and below is the liver and gallbladder. It is necessary to ask about the chest symptoms because some of them occur frequently in practice. In particular, symptoms often manifest in the chest. For example, a feeling of oppression may be felt there or palpitations, which often derive from emotional stress. Patients do not often volunteer information on chest symptoms unless we ask. For example, few patients will actually describe experiencing a feeling of oppression in the chest. In addition, both the tongue and the pulse frequently reflect a pathology of the chest. A purple area in the tongue chest area, for example, or a pulse that is weak and deep in both front position. So we have here the illustration of a purple color in the chest area, which is the lungs or heart, or in women, it also indicates the breast. Chest symptoms often reflect very common pathologies such as liver chi stagnation, phlegm in the chest, and heart blood deficiency. Therefore, specifically, it asks about chest symptoms quite early in the interrogation as the patient is describing his or her symptoms. So how we ask, it is important to be sensitive when asking questions regarding the chest because people often fear that if we ask about the chest, we suspect a heart pathology. Besides this, some typical Chinese expressions are not used by Western patients, and we should therefore phrase the question in a way that is understandable to the patient. For example, a few patients will actually use the expression feeling of oppression of the chest. They will probably describe a feeling of tightness of the chest, or say a feeling was like having a weight on the chest. Palpitation is another example of the importance of asking questions in a way that the patient can understand. Most people think that palpitations are synonymous with tachycardia, that is, the heart beating faster than normal. We should therefore explain to the patient that palpitation simply means an uncomfortable sensation of being aware of one's heartbeat. One could have tachycardia and not have palpitations. So here in the thorax, we could observe pain, which signifies heart blood stagnation, heat, or cold. If there is unrest and turmoil, it signifies heat. If we could feel that there is heaviness, it could signify that there is phlegm, tightness in the chest, G stagnation, pain radiating from the heart and down the left arm is the heart blood stagnation. Thank you for your attention.